Welcome, Jason, my man.
What's up?
This is episode 2 of the 2025. We're in 2025. Things are wild on the stock market, my man. You have created a monster over here. I don't think I realized, I think I said this to you, but like I think in you're my older brother, so you just preceded me in life in general.
Yeah.
But I
get to make the mistakes, and you get to like learn from them.
I don't want to say it that way. It's going to be more politically correct. But
just say it.
I
We know it's
learned
true.
from you.
Yeah.
And then, but then also like I kind of think I let you go out there and blaze the trail and learn the mistakes. And I'm like, oh, that's interesting what he's doing. And then you're like, hey, you should consider testosterone replacement. And so then I watched you do it. And I was like, maybe I would do it a little different, but I do like that.
Yeah.
And then some medical aesthetics, what I wanted to talk to you about today. But then also you've been doing some investing of your own, because we all know physicians are phenomenal with money. So you've been learning, you've been teaching yourself. And so I've been watching, and I just want to say that I'm coming behind you. I'm coming strong, but you have created a Wall Street monster.
Yeah. Well, you know what I think too. It's
so
for.
good.
Let me ask you. For me, it was like I never thought I was allowed to think about investments. I didn't think I'm not this. I'm not that. I'm less. I mean, honestly, if I'm real honest with you, and I think a lot of people like that are like, I'm less than. I'm not supposed to think about it. I'm not allowed to think about it. Now, I would say the new generation that's coming up, I've noticed it's kind of like,
very different.
Very different. But we didn't have Robinhood in our day. We didn't have cell phones,
meme coins and Bitcoin, and
like producer Grady's of the world. He's probably a trading wizard. I mean, I don't know, but his generation, like it's more in their, even in the way they talk. It's more in their native parlance. Like, but
they're a little bit more risk tolerance in that world too.
Well, and age-wise, they can be too. Not to,
like,
I mean,
what was the first giant move that I was allowed to, by allowed, I mean by my brain, was to like invest in a mutual fund.
Yeah.
I remember that.
Yeah.
Like I would just put in a little bit, and Dad set up a mutual fund for us, and I put in a little bit and a little bit and a little bit. And then by God, it grew 8% over the last 12 years. And I was like, but in a weird sense, like the thing that I think maybe this generation is lacking is sort of like looking at a 15-year window. Because as low of a percent that 7 or 8% may have accrued, it was actually the seed money that I used to buy the building that we're in.
Right.
Which, but it took 25 years to accrue. But now, yes.
Had you not ever done it and taken a step. And so it's, again, a lot of
mix those two worlds, man.
Mixing what two worlds?
A little bit of risk tolerance, a little bit more knowledge, a little bit more understanding, a little bit not being scared of the stock market.
Yes.
They're not better than me because you just take the time to learn it, and I can go slowly. And I also now have this ability to sit on something for 10 or 15 years, and that doesn't bother me, and I can kind of put those two together.
Well, that's an advantage. Yeah.
But my Robinhood count is growing, and I'm coming for you.
Good. I want, and that, anybody that's listening to this right now, if you, they'll say, "Oh, that's your job, Doc. You're supposed to." Well, I get that from a sense, but like, I'm just a big believer in accruing, not doing it out of context and not doing it willy nilly, but your area of expertise is important. But like, just because you're not a Wall Street mogul and you're not doing Forex trading and you're not living in Dubai selling meme coins and going on the other exchanges over in Europe and whatever, it doesn't mean you can't understand how money works. Ray Dalio, right, hedge fund of hedge fund fame, the largest hedge fund in the world, and just an all-around great guy, has a free series, a free app. I mean, he'll teach you, just from the sheer point of learning how money works, how debt works, how economies work, understanding macro principles, and then being able to make some financial decisions on your own, I think is so worthwhile. i.e., it models availing yourself of information of medical processes, human biology, working with that, understanding where you can take what was thought to be risk, or maybe just changing some things, accruing that knowledge and getting real results. I just think it's important. I think it all kind of fits together, educating yourself. Yeah. So I'm glad to hear you're having fun.
Yeah, I'm having fun and I'm learning. One of those other things that I'm coming behind you and late in the game is this medical aesthetics. You've been doing it much longer, and your wife certainly has been doing it longer than both of us.
Yeah.
But it's been really cool for me. I think I had a misconception about what aesthetics was, maybe because of the era we grew up into, like the sort of what I viewed medical aesthetics being. And so, but there's a real functional side that is present in medical aesthetics. You can take something as simple as maybe like a plastic surgeon with a double mastectomy patient, right? That's obviously not for some silly preconceived notion of what femininity should be, and you don't meet that standard, so you want to change it. But also something very much the other end of the spectrum, like with these GLP patients who are starting to lose significant amounts of weight. What do they do in return, and what are some simple, effective things that they can do to then maybe take that next step, whether they want to continue changing the way they look or have started to maybe realize that there is a possibility of change and they have some other simple things they want to do. So what are you guys doing in your clinic to sort of address that?
Sure. I think there, thinking about COVID, there was the Zoom boom. So the Zoom boom referred to everybody going to video conferencing communication. Zoom was the popular platform at the time. Now we've got Microsoft Teams, Google Meet. Yeah. So everybody's up close and personal. And never before did I realize, for instance, doing this podcast.
The face here.
I know, right? Yeah. Like so people were, so the big time thing that was going on that time was they were brightening their teeth. It was the Zoom boom, but all the aesthetic things, everybody's on Instagram, everybody's filtering things. So people are worried about, concerned about their appearance, want to put their best foot forward. I get that. And when you start losing weight and getting results, you're looking for, you have a resolution. The resolution is to lose weight and improve your confidence, your appearance, your functionality, your health. And a lot of people are saying to me, hey, Dr. Farah, I want to look as good as I feel. I feel great on these hormones now. I feel great, but I want to look that way. And we talk about things that occur.
I agree. And I also think that, sorry to interrupt you so abruptly there, but I think also patients sometimes achieve a result they didn't think they could. So then they're like, maybe I could
what
do
else
those
is
things.
there?
Maybe I'm allowed to do those things.
Yes.
Maybe that's okay.
Yes.
I didn't ever think I would want to do those things or could do those things. And so that's another big part of it is I see is like, oh, this has been an interesting journey. Now I got some success. What other, like I have patients who now like, I lost the weight. I'm coming to the gym. I know I can do these things. I learned, like a new skill set and I want to learn other skill sets.
Oh, I love it. Yeah, I think, hey, maybe now that I've gotten back to working out, losing weight, maybe I can do CrossFit or I can try other things. And then that rolls over into what can I do to look as good as I feel? Or maybe there was things about my appearance that I didn't even care about before. Now that I feel okay to look at myself a little bit more, I hear women a lot too talk about, it's interesting, man. Women's libido has been really fascinating. I'm not trying to be goofy. It's been a really fascinating, interesting journey to learn women on a whole nother level when you're providing hormone therapy for them than I ever understood. Even, being a married man in the relationship, it's just interesting. So for instance, like I hear this a lot from women where their husbands are like, oh, no, you look great, honey. I'm so attracted to you. And that's true. And I know. I mean, I can vouch for that. I can be in that. And I've had this conversation with my wife when after the third baby, she had gained so much weight and we both were unhealthy, but also she didn't like her appearance. If she didn't feel confident about her appearance, you can have all the hormone in the world. Now, men are probably the same too, to some degree. Although I think sometimes it's an overdrive, so that libido probably takes over.
Sure.
But women describe very interestingly that if they feel good about their appearance, their libido suddenly increases. And if you delve in further, like, well, I feel comfortable being naked, or I feel comfortable in my own skin, and that allows my guard to come down. That allows me to let somebody in an intimate way and have a connection to then feel comfortable in an intimate situation. It's been really, really neat and really gratifying to kind of understand that a little bit more. So here they are. They've lost weight, and now, and a lot of times, not everybody, but a lot of times when you're gaining weight, you're older, right? So you're fighting another battle, and that battle is against Father Time. So if we're losing 1% of collagen per year in our body, while we're also gaining weight, the skin's going to stretch, and then there's gravity. And the gravity is important because you can see it in my face even. See how these marionette lines are here? And so what a youthful face does...
That must be genetic because we both got those.
It is partly, but a lot of it is just normal human aging and gravity.
Right.
So we talk about a youthful appearance to a face as an upward facing triangle, whereas what happens in aging is a downward facing. So you'll see. So youthful. This is how I looked. Do I see that burn? It just falls. So what a lot of people are wanting to see is facial slimming. Like, this is interesting. When we first started this journey, like, I've had a few Morpheus treatments in my face. I've noticed that.
Oh, have you?
Yeah. My face is a lot slimmer now, and I weigh the same. It's not a weight thing. I weigh exactly the same.
Oh, interesting.
Yeah, and so even people have commented lately on, and
Your
so
face is slimmer.
Yeah, and so what I've done is had Morgan really contour with the.
So before you go down that, so I know you said Morpheus, but for the people out there, so would you is one of the big things that you're seeing with the weight loss patients is then loose skin?
Correct. So I'm losing 1% of collagen and elastin per year in my body, and I'm gaining weight. I'm stretching that skin. Now, as I'm getting older, those elastic elements are less. So there's not a snapback to the skin. So there's a skin laxity that's apparent around the abdomen, around the arms, in the face, the submental region, all over the place, thighs, around the knees.
And so your guys' preferred is the Morpheus? Is that what you're saying?
Well, that's a really complex topic because we do some pretty advanced stuff in the clinic.
Right.
Not advanced as to what's and certainly not according, not what a plastic surgeon could do. Excisional, meaning cutting away stuff. It's not that I haven't done or helped out with those things in the past in my role as general surgeon, but I mean, what we're doing in the clinic, we're doing liposuction and some really higher level body tight and stuff, radio frequency, skin contraction. But the good place to start that's less invasive and more easily accessible from a monetary perspective is Morpheus, and it's radio frequency microneedling. So you have radio frequency.
Yeah. So I think microneedling. Let's go there first. So how would you kind of break that down in layman's terms?
So it's radio frequency energy is electromagnetic waves. Okay, and I just wrote a couple notes here so I could. So 3 kilohertz to 300 gigahertz, which doesn't mean any difference to anybody, but it's non-ionizing radiation. It's like a current, okay, at a certain wavelength. It's passed through electrodes, in this case, bipolar electrodes, so a positive electrode and a negative electrode. That makes sense. And then that produces an energy. It's a thermal energy. So that
energy.
What's that?
It produces a heat energy then?
So it would feel like to a patient like heat. Absolutely. So, when as a general surgeon, we would do this a lot in liver, working on the liver, tumors, liver. You kind of put these prongs in the liver and you basically burn tumors and things like that. In the case of aesthetics, radiofrequency-based aesthetic treatments are, stimulate collagen production, which helps with wrinkles, which helps, again, if I can have the structural elements supported here with collagen and elastin, I'll have less of that wrinkle formation and degradation and the effects of gravity. Also, underneath your epidermis, the outer layer skin, and then the next layer down, dermis, one layer underneath is the fibroseptal network, a contractile kind of fibrous network of fibrous tissue that kind of anchors the skin to the underlying muscle and fascia. And that is specifically targeted in microneedling procedures with radio frequency by these gold-plated needles, which serve as electrodes to conduct current through, penetrate the skin. Of course, it's numb, and we're giving you treatments to like Pronox gas to make you feel good, not I don't care medicine, laughing gas. They penetrate the skin and they deliver that radiofrequency charge. That radiofrequency charge then in turn stimulates collagen and elastin, creates microtrauma, so inflammation comes in, and your body heals that. And part of the healing process is to laying down new collagen matrix. If I can stimulate that, then again, it will reduce the appearance of fine lines and wrinkles. Not to mention, I'm contracting the fibroseptal network. I'm basically shrink wrapping the skin. So, and oh, by the way, you're destroying fat. You're like literally melting fat because of the thermal injury. And Morpheus is fantastic for that. You guys have one in your clinic, and you can use it.
We've just started using it. I would say I'm behind the 8-ball or the curve, whatever, in sort of fine-tuning my ability to facial aesthetics. Like, that's still a skill I'm learning. But we had a patient recently who did the Morpheus on their abdomen. And so she had what I would call as, like, she was, I don't know her age. I was just looking at a picture, so guessing by it, I would say probably 50, but had by no means big, but had some loose abdominal skin. Looks like maybe had a pregnancy, and then that skin stretched, and it just wasn't fat, wasn't hanging, wasn't below the waistline, wasn't a fupa, but just was
mild,
different texture than the rest of her
texture
abdomen.
too. Right. Yep.
Right. And so the after pictures on which I always thought of the face, but the after pictures on that abdomen, I was like, holy moly,
see?
That is amazing.
Okay, you didn't even tell. I want to see that because I haven't.
I'll have to show it to you. Yeah.
Yeah. Oh. Is that on your Instagram? Is it on your Instagram?
I just sent it to our social media lady so that she could.
It's pretty shocking, isn't it?
It was pretty cool. I was like, holy crap, because I have, for better or for worse, like my tilt towards aesthetics is so light because maybe personally I just don't like do a whole lot of aesthetics with myself, so it's hard for me to get involved with it. I tend to.
Hey, you take care of that beard.
I take care of the beard. This is it. This is the number one thing. So yes, lotions or potions are important, but I don't generally do a lot of other things. But I was like, oh, that is functional significantly. That is not like making it for lack of a quick thing. That's not like the double D breasts from our generation, that first iteration of doing these kind of crazy things. I think of like the whatever, pop culture thing that was in popular at the time. I was like, 100%. That was quick, effective. Functional aesthetics. I could see the value in that quickly. It worked great. No pain in the treatment.
Right.
We use a topical anesthetic, lidocaine.
No pain because you took the right necessary steps to prevent the pain. Now,
here's what I hear. Yeah.
Otherwise, it's very painful. Yeah.
Yeah. You have to use the right anesthetic steps. And we have found a gentleman out of South Florida that makes amazing
plasticized lidocaine, or plasticized local,
It is the best, and that's probably one of the biggest complaints too. We're kind of going to different things, but I heard from women, because I wasn't so well versed in this area, but it's like, I don't want to do more if it's just so painful. And I was like, oh yeah, well, let me try it, and I have not heard that from any of our patients. If we use this significantly, it's been a really great. Who actually InMode turned us on to? A lidocaine.
InMode is the maker of Morpheus. Yeah.
Yeah.
So this thermal effect stimulates fibroblasts. It triggers collagen and elastin production. Okay. The heat coagulates the fat and tightens the connective tissue. Okay. So it's effective for skin tightening, wrinkle reduction, and fat remodeling. And the micro injuries. So it's threefold. The thermal effect stimulating the fibroblasts, collagen, and elastin, heat coagulating fat, and tightening connective tissue, and then micro injuries creating a healing response. So it's a great tool. This is very little social downtime, very little downtime at all. I mean, for me,
I
just go.
Stacy was our tester. We shouldn't know downtime.
Yeah. Morgan too, and Morgan just posted a before and after of her own face with Morpheus, and she was the same weight too. Interesting that she had lost some weight on tirzepatide, had gotten to her goal weight, and then started doing these procedures. But the contouring effects are really fascinating. So one of the big things is generationally, or what's in vogue now, is trying to be more natural, and so not wanting to put tons and tons of lip filler all over the place, create problems down the line. Simply taking that knowledge of what your body does, what it responds to, and just enhancing what your body can do on its own. I mean, that concept sounds a lot like peptides. That concept sounds a lot like the episode previous to this one. I mean, and I think there's some value in that, and people desire that for sure. And one of the things that's fantastic for this is specifically Morpheus 8 from InMode on the body and the face, in the hands of people that know how to do it, and that's key, right?
Yeah, we've done a lot of training with you guys. We spent 6 to 8 months training before we even touched a patient.
Oh, by the way, look at the. If I'm happy about this to any degree, and I am, you know who I need to thank? You know who I need to thank? You know who did my second Morpheus treatment? Melissa.
Oh, did she?
Yeah. She did the whole thing. She did the whole thing.
That's right.
She's got great hands. She did a great job. And
so how many sessions do you say?
Good key. That's a really good question.
Because I was like, you had those amazing results, but surely, I mean, nothing in medicine is a one and done, right?
Okay. So when we were going through this journey, the first one we ever got, first machine we got was Seal Firm. I don't recommend Seal Firm for general use. It's very specific, like around the eyes, and for PRP treatments on the scalp. That's what we like to use.
That's another manufacturer. That's another manufacturer.
Correct. Another brand, another manufacturer. Yeah. But it is inferior, in my opinion, for facial aesthetics. Then I had 2 Morpheus treatments of one, which was Melissa. So I think I've had 3 microneedling treatments over the course of a year in total. But Dr. Talon Meningus, who has a plastic surgery group in Arkansas, Joplin, Missouri, fantastic, really great plastic and cosmetic surgeon who works with InMode specifically. So yeah, there's probably some bias there, but he's just a fantastic, smart, really good surgeon anyway. Kind of taught me, and I've seen this to be the case. They will recommend that you do a series of 3, and I have found typically that's what it takes. Although you will see some results even after the first one. But like anything in the body, the cycle of producing inflammation, the body then reacting, healing that inflammation, and then remodeling to occur takes a while. So I have found
how far apart are those 3 weeks? Or those
6 weeks? 6 weeks apart, 4 to 6 weeks apart. But here's the key. For me, I got really discouraged because the first couple was like, but it wasn't really until the second. Maybe I've had 4 in total. I don't know if 3 or 4. Anyway, it wasn't until the latter 2 that I finally noticed results. So a couple things with that. His take on it is it works. It hurts and it works. Dr. Mulholland talks it hurt, But now again, we talk about taking care of the hurt part, but it works. Meningus will tell you he doesn't know. Everybody has a different timeline, so it depends on how much fat you have to destroy, what your body's response is going to be, and that's individual in terms of collagen production, elastin. There's people that respond differently with inflammation. And we see that. I see in the trauma literature, and for instance,
probably if you're younger, if you're starting this when you're younger, you doing it versus, we did
exactly.
this treatment on Mom.
Exactly.
She's 80, you're in your 40s. That probably a preventative would probably be a good idea, right?
No, the range I've seen is minimum of 3 and up to like 8 sessions, and some people. But you will get the results you want. You just don't know when you're going to get there. And what I've also noticed is the 4-month mark, 3 to 4 month mark from the time of the procedure seems to be the sweet spot that I've seen where the injury occurs, the inflammation happens, the inflammation subsides, and then the remodeling happens in response. So I've seen that with liposuction and body type procedures, and then they look terrible for the first 6 to 10 weeks, and then finally at the 12 to 16 week mark, it just like shrinks and just sucks in all of a sudden. Yeah. It's amazing. So you got to do enough treatments, and you got to give it some time.
What do you think about this? I've been kind of going down this preventative, like we take all these treatments for when something occurs. What if you had somebody starting a GLP weight loss journey, and you did your first session of Morpheus that day? So as they're losing that weight, the body is also healing itself. It takes a little while for the GLPs to kick in, and then that 6 week.
It's so funny with this podcast. Like sometimes there's such a mind meld. I'm like, it's almost like we play. Like when you say that. So Morgan, it's crazy that you said it. Morgan and I have talked about this because one of the problems is sometimes if you're losing weight and you're noticing skin laxity, and then you continue to lose weight, that skin laxity is not going to get better on its own. Mm-hmm. Okay, obviously, and the more weight you lose, it's going to get worse and worse and worse. So I have thought introducing a protocol in the clinic, and it's exactly what you just said. I have not done this yet, and we've just, it's just a matter of how many things can you do at one time and live. But I mean, you're right. I think what you need to do
comes from us, because I think sometimes I find myself doing this. I'm always looking for, if you asked me, you're like, dude, what should I do? I'd say 100%. Do the GLPs, do your pellets. Don't waste your time with injection. Do the pellets and do a peptide and come to the gym, right? Mm-hmm. But because I know you, and I'm like, dude, just do it. I know it's expensive. I know you don't have the time, whatever. Just do it, right? I would be very much forthright with you. But in the presence of a patient, I'm very mindful, maybe sometimes too much, of like, I don't want to be selling you on something. I don't want you to overextend yourself. I don't want you to feel like you're being pressured into anything. I kind of want to keep my opinion out of it. I want to let you make the decision. But I think I err too much on that side.
Yes.
And I kind of did that with the semaglutide tirzepatide. I'm like,
yes.
Well, just try the semaglutide. See if it works. You might do really well, and you don't have to spend the money. And then lo and behold, I think trying to be nice to these patients, I may have even cost them more.
Yeah, because they were on it longer. And
how
ironic, right?
But, right?
Absolutely.
And so I'm thinking, like, I sometimes am my own worst enemy in that. Like,
Yes.
just I tell this to my pellet patients. They ask like, well, on injections, they had this protocol that we kind of follow. With pellets, it's less protocol based, and I just say you have to trust me that I know what I'm doing. I feel confident in getting your dose right out of the gate to 2 treatments. Give me up to 2 treatments. But you have to put that full faith in me. There's no other way. There's not some great algorithm for pellets. I believe that to be true. But
clinical experience counts for a lot.
Yes, but I am apprehensive in other areas when I think maybe I should just tell the patient, it's going to take you 3. Start now, today. Let's get your tirzepatide. Let's get your Morpheus 8 going, because you're going to want that and you're going to do great, and let's go. So,
yeah, and I noticed this one time recently. It finally dawned on me. A woman was talking about that. She had kind of been passed around the office facials and skincare, and people she's like, look, will somebody just tell me? I'm here looking for expertise. And she was kind of frustrated. She looks at me. She's like, will someone just tell me what to do? That's what I'm asking you guys to do. And I felt ashamed, because I was like, here I am trying to be so, I don't know, whatever, kind of the moral, trying to not pick a side and trying to be like exactly what you just said, whatever that is. I was trying to think of a cute way to say
here's
it.
the pros, here's the cons.
Right,
and you decide.
right.
They're like, well, I don't know. You tell me. You're the expert.
Right. And I was not even giving her what she wanted. I'm like, oh my gosh, you're right. You want my best recommendation, then you'll decide. Okay, so here's my recommendation. Yeah, you're right. But I think you have something there. I would say move what we have done lately, and what I would recommend, and even talking this through with you, seeing that you're experiencing the same things. If people come in for their medical weight loss journey, you got to tell them, look, you're going to get rid of one problem, but you may just accrue another problem, which is a function of age, gravity, but also weight loss. You can make that less of a problem by taking care of it as you go. Yes, I do believe there's a process for that. I don't know that it's been really delineated, because it's kind of hard. It's kind of guessing. But if you're doing these procedures on the face and abdomen, or wherever their problem areas seem to be, you're going to cinch down with them. As they lose the weight, you're going to kind of cinch down with them. Yeah, and that makes sense.
Me, take for example, for me, someone like I look in the mirror. Maybe I'm just not attuned to it, but I'm not particularly like, oh, I got to work on this or work on that. But I can see it coming now at this age. Like, oh, you're not 20. What would you say to someone like me, who I've come to the point now where I would invest in something that's going to happen. I think 20 years ahead is what I tell everybody. I'm thinking about 60.
Yes.
And so could I do 1 a year, or is that not enough? What do you think? I know there's no data on it, but nobody does it that way. But what do you think about that?
Here's what I think about it. I think I would do the series first to lay the groundwork to get the maximum response.
I like that,
then because here's what you want to do. You want to build up all that collagen and elastin to then is going to slowly degrade, right? And you're going to say, oh, now do it once a year. And I'm degrading, back up where you are. Degrading, back to where you're at. But you got to get there first. So you got to lay that foundational. If you do 1 a year, all you're doing is maybe staving off the natural degradation. You're not optimizing, because
you're delaying but not building, maybe.
Right, and you're not getting the actual results. You're simply kind of slowing the time. Like in other words,
it's probably a minimum threshold too.
Right. Like Jeff in 20 years is going to look way better if he did the first series first and then did it once a year, as opposed to just kind of doing it once a year.
Yeah.
It's not wrong to do it once a year, but I think you may feel people will be unsatisfied with that.
Yeah. And I'll tell you where this thought process really hit me. This is a weird random tie-in, I get it, but I trained a pellet doctor, and she worked at a sexual wellness clinic.
Yeah.
And so all day they were treating erectile dysfunction men. Right?
Yeah.
They had a protocol they did, and it included shockwave and laser, and PRP injections, and then they were learning pellets to add into it. So I was teaching them the pellets and how to do the insertions. 2 things. I was sort of awakened to how maybe prevalent that problem was.
What's that problem? ED?
Erectile dysfunction, yeah.
Yeah.
It was a men's clinic. The age demographic was not what I expected. It was not all
younger?
men. Yep, it was younger than I expected. Then it got me to thinking, I have a shockwave here, what we use for orthopedic, but I was like, I wonder if somebody had told those men, because it's not 100% successful by any means. I think we all think it is. But like, what if we had started when they were 40? Mm-hmm. Not you don't. Now we're doing tadalafil, shockwave, 6 or 8 treatments. Those
You're trying to catch up.
You're trying to catch up, and I was like, wonder if I should start planning for that at 60.
Right.
And that's what kind of got me. I was like, I
Prevention.
need to start thinking. Yeah, I need to start thinking 20 years ahead actively, and maybe adopting. Because I'm doing really good work with my nutrition's getting better, but my exercise and my mental health, and I'm planning. But I was like, I don't really take advantage of some of these, not hacks, but these some more medical geared things. And I was like, So I think I'm going to take your advice. I think I'm going to try 3 Morpheus.
I would do it. You got it there. And then let us know your results. It'd be interesting to see. I mean, that beard covers a lot.
Yeah, we'll have Grady taking a snapshot. I know, I can't shave, right? I mean, how much can we work? I'm going to have to trim the beard. Neither would kill me.
The forehead and the maxillary region that we can get. And yeah.
Yeah.
But yeah, so remember, there's a really good tool, radio frequency. It's safe. It's super effective. It's not costly in a relative sense, because in a relative sense, I am going to compare it to a facelift, right? Or excisional surgery, deep plane. Now, those are awesome. And the guys that do that and the gals that do that, they're phenomenally talented. I take nothing away. But if you could push that off and or avoid it altogether, would you not? Yeah, of course. And it's a lot cheaper and a lot less downtime and a lot easier to recover. So hopefully people will they're waking up to the fact that they can start earlier and prevent a lot of these things. So,
yep, I appreciate it, man. I like the Morpheus. I'm glad you introduced me to that platform.
I love that you did on that patient's abdomen. That's so. I didn't. Even know
I tried to email you the pictures, but I didn't have your email in my business or my clinic's email. I didn't have your address. So, I was shocked. She just showed it to me. I was like, "Holy moly, it's great!" Yeah. So I'm gonna
pretty cool, huh?
I'm gonna go down that road personally and see what we can get.
Producer Grady, you know what? Can we, if we give you some information, can we maybe, for the folks at home, show? Can we attach somehow to these to the? Okay, let's see if we can get some pictures.
Look at this picture
in the top here and here and here. Oh, very cool. Yeah.
I'll forward it to you then.
Awesome. All right, man.
All right, buddy. Appreciate your time, man.
See you on the next one.
All right.